Hello, this is OR proning technique for the Hovermatt. So just wanted to go over a few things. What we have today is just a bed and our hover jack as far as surfaces. Typically you'd be using a stretcher and an OR table, but we'll use what we have for this demonstration. And really a couple things we want to do to set ourselves up for success. The first is that before we're going to do this prone, we're going to actually raise the surface we're proning away from just a little bit higher than the OR table, so we're on a little bit of a downward slide. The other thing we're going to do is take the arm that's on the side we're proning towards, and we're going to tuck a pillowcase or a towel underneath the back of the patient, up over the arm and back underneath the patient's back, so that arm is kind of secured to that side. So once we do the prone, the arm's not flopping and moving around. So the next thing we'll do once we're in position here is we're going to inflate the Hovermatt and get it to overlap that OR table a little bit. The reason we do that is we want to make sure that the patient's going to land right in the center of that OR table and not come up a little bit short. Alright, so I'm going to go ahead and attach the air supply here. We're going to move our patient over, so snap connecting to the snap on the inside of the Hovermatt. Velcro over the top. I'm going to hit our adjustable speed twice, and then I'm going to hit our full inflation button. Alright, we'll hit the standby button, and now we're going to take the Hovermatt on the side of the OR table or the side we're proning towards and tuck it fully underneath the patient. What we're doing is we're restricting the airflow on this side so that when we inflate the Hovermatt, it's going to blow up on this side and get that momentum going to move that patient. We just want to make sure it's fully tucked in all the way underneath the patient's head and feet. We don't want any of the mat showing, otherwise it's going to inflate out from this side and we're going to have to start over. So typically we'll have somebody else operating the air supply, so we'll count it off. We're going to go with the full inflation because that gives us the most momentum. And then I'm going to pull up on these handles. Opposite caregiver is going to usher that patient down into position. So we'll go ahead here. 1, 2, 3. And then we'll shut off the air supply. Now, of course, our OR table is going to be about 20 inches wide, so definitely a lot narrower than the surface we're transferring or proning onto right now. So good representation of this technique, and it really is pretty useful when it comes to those patients that are a lot heavier and getting that initial momentum going. That's where a lot of the injuries occur. Thank you so much.